A tale of two pandemics. As the UK and Denmark end coronavirus restrictions completely, other countries are imposing even stricter measures, including compulsory vaccination. With Omicron case numbers surging, which approach is the best? I'm Andrea Sankey, and today's Newsmaker is the world's diverging responses to COVID-19. Now, after the Omicron variant triggered a brief return to stricter measures, some countries are now easing or completely ending their COVID-19 restrictions, saying hospitalizations and deaths have not increased to the same extent in spite of the surge. The UK is now back to its so-called Plan A, ending mask mandates, COVID passes, and work-from-home orders. British Prime Minister Boris Johnson said Omicron tested his plan to withstand winter without restrictions and to learn to live with the virus. Facing growing calls to relax measures, the Netherlands will also ease restrictions, which the Dutch Prime Minister has described as a risk. And Denmark has announced it will also remove all remaining coronavirus measures starting in February, despite high infection rates.
From now on, the government is no longer asking people to work from home. And people should now speak to their employers about arrangements for returning to the office. And having looked at the data carefully, the Cabinet concluded that once regulations lapse, the government will no longer mandate the wearing of face masks anywhere.
From February 1st, in only a few days, Denmark will be open again, completely open. It marks a transition to a new time for all of us. During the pandemic, our patience and our perseverance and our unity as Danes have been tested. And today, we can say that we have passed the test. We are ready to step out of the shadow of the coronavirus. We say goodbye to the restrictions and welcome to the life we knew before coronavirus. The pandemic is still here, but with what we know now, and we who stand here dare to believe that we are through the critical phase.
But in stark contrast, there are other countries implementing stricter measures, especially for the unvaccinated. China has stepped up its zero-tolerance COVID-19 strategy ahead of the Winter Olympics, imposing lockdowns and mass testing in the Chinese port city of Tianjin after just 20 people tested positive. Germany's 7-day case rate hit a new high since the start of the pandemic, leading to new restrictions banning unvaccinated people from entering restaurants, bars, and cultural events. And New Zealand is under its highest ever restrictions after an outbreak of 9 Omicron cases. Even Prime Minister Jacinda Ardern was forced to cancel her own wedding. So with various governments choosing diverging paths, the World Health Organization is warning of the danger in assuming that we're nearing the end game.
There are different scenarios for how the pandemic could play out and how the acute phase could end. But it's dangerous to assume that Omicron will be the last variant or that we are in the end game. On the contrary, globally, the conditions are ideal for more variants to emerge. To change the course of the pandemic, we must change the conditions that are driving it. If countries use all of these strategies and tools in a comprehensive way, we can end the acute phase of the pandemic this year. We can end COVID-19 as a global health emergency, and we can do it this year. What does that look like? It means achieving our target to vaccinate 70% of the population of every country with a focus on the most at-risk groups.
Now, while the WHO is pointing out vaccines are the best way to curb infections, some countries are taking restrictions a step further for people refusing to get the shot. In France, a negative test no longer suffices in lieu of a vaccine. Proof of recovery is now the standard for entry into many indoor spaces. And the Canadian province of Quebec has become the first in the world to charge its unvaccinated residents a health tax. But protests against vaccination mandates are growing in some countries. Tens of thousands marched against restrictions in Belgium last weekend after the country's premier said everyone would need booster shots to keep their COVID-19 passes for restaurants, bars, and cinemas active. In Canada, truck drivers sounded their horns as part of a protest against a vaccine mandate for the trucking industry. And in the United States, thousands of anti-vax and anti-mask protesters rallied demanding an end to mandatory health measures.
Well, I'm here because I'm already free, and all these people are free, and we're all coming together, because right now this is a time for coming together and not being standing apart, and not being torn apart, not losing our jobs, not losing our families, coming together and being free together.
I'm really very angry, because I'm angry about the blackmail that the government is doing, mostly for the young people, but for everybody, but most for the young people. They are really blackmailing that everybody has to go for the vaccine.
I'm not against vaccination. I think if you want to get vaccinated, that's your choice. I'm not against wearing masks. If you want to do that, that's your choice. I just don't think anybody should be forcing anyone to receive medical treatment.
So why can't we all agree on whether it's time to reopen or if that's still too risky? To help answer that and much more, I'm joined now from Geneva by Dr. Edward Kelley. He was the director for the WHO's Integrated Health Services. He is now the global health lead for Apiject, a company working on vaccine deployments. Oksana Pyzik is in London. She's a senior teaching fellow at the University College London School of Pharmacy. And Jeffrey Lazarus is the co-director of the Viral and Bacterial Infections Program at the University of Barcelona, as well as the head of the Health Systems Research Group at the Barcelona Institute for Global Health. Thanks all so much for being with us. Dr. Kelley, let me start with you. It's just so contentious at this point, and each country seems to be charting, its own path. Is it okay for that to be the case? And if so, whose strategy to you looks to be the best informed and most in the interest of public health?
Well, Andrea, first off, thanks for having us, and it's a great panel to be together. But this is a key question that all countries are wrestling with. And by definition, it is, quote unquote, okay for each country to decide its own path, but it's also quite clear that what our overall target is control of this virus. We've got three levels of what happens when a pandemic winds down. You can eradicate a disease. We've only done that once in the history of the planet with smallpox. You can eliminate a disease, and we've done that in certain parts of the world for things like polio or malaria, but that's rare. So then there's a broad range of what we would call control, and it's a question of controlling the disease at a level that allows regular functioning of a society, and also for health systems not to be completely overwhelmed. So you see, in answer to your question, a number of countries that are wrestling with health systems overloads because they have opened up too early. And you see other countries that are threatened with health systems being overloaded because they have had a very, very strict lockdown policy, and that would be places like China or New Zealand, that now that they're open, Omicron has totally changed the game on this particular question. So it's a matter of balancing all those public health measures with how well you've been able to vaccinate your population.
For you personally, though, do you see a country that has, in your opinion, kind of something closer to an ideal formula right now, that's doing really what you see as the right thing?
Yeah. I would say I'm going to pick two countries from the different range of a spectrum. Japan has done, in this recent wave, has done quite a good job of managing relatively strict measures locally in terms of keeping mask mandates, keeping restrictions on gatherings, managing what kinds of institutions can be widely open, such as nightclubs, et cetera. but also not having their economy completely locked down. Now, last week I would have said they're getting an A plus. Of course, cases are now rising there too. So week by week, we can come back and talk about who's doing well and not doing well.
Right.
Another country throughout this outbreak that has done very well has actually been Liberia. It was one of the first countries to put in testing at the airport and to have broad sort of hand hygiene stations in the community. And that's because they have a legacy of dealing with Ebola. So it doesn't mean that you have to have a lot of money to manage the outbreak.
To be responsible about it. Very interesting. So Japan and Liberia. Jeffrey Lazarus, let me turn to you. In a lot of ways, actually, I mean, everyone is kind of gambling at this point because no one can really guarantee how this virus is going to behave, if it will mutate again. Do we all pay a price, though, if one country does gamble and loses?
We absolutely pay a price. I mean, going back to your earlier question, I would have said until summer that Denmark was an exemplary country. They had the testing in the airports. They had masks in public transportation. They really treated the pandemic seriously and kept cases extremely low compared to the rest of Europe. Now they're lifting their restrictions, taking the gamble that you just mentioned. So on February 1st, they throw all restrictions to the wind. We know infection rates are very high there. They will go higher. And their reasoning is that hospitalization is relatively low and mortality is low and cases in the ICU are low. So we will start to see a test case from Denmark. We know there's a sublineage of Omicron that they're studying there. So there's worries of reinfection from one sublineage of Omicron to another, and we'll be able to find out from Danish data how that's going. I'm particularly concerned about long COVID as well. I think we focus very much on mortality and not just morbidity. So a gamble is a gamble, and a pandemic is a global situation. So a country cannot declare the pandemic is over in their country while it rages in other parts of the world.
Right. Oksana, you're in the UK, a country with one of the highest per capita overall death rates, if not the highest in Europe, one of the highest, I should say. How are you feeling about, Plan A being reinstituted and basically all restrictions being dropped?
Well, I think it would certainly be a safer measure to gradually reduce restrictions instead of removing everything all at once, particularly when we do see that cases are still very high. 1 in 10 school-age children currently have COVID. So schools are facing huge amount of transmission, which affects, of course, parents, grandparents. There's a lot of disruption that is still occurring. There are only about 7,000 of these filters, HEPA filters that have been made available at schools. We need something like 300,000. Keeping things like masks in place, particularly in learning environments where there's so much mixing of children and teachers, it would be sensible to keep masks on. And some schools have done that. They have ignored the advice of the government, and they say in their institutions, mask wearing will continue. And many other employers and organizations are taking the more cautious route, because wearing a mask is not actually a restriction. It enables you to move around freely, do activities, etc. It just keeps, depending on the type of mask as well, those who are more vulnerable should be looking to wear a FFP2 or an N95 mask, especially now that the UK has really dropped its guard.
Right. And I mean, wearing a mask actually, more than anything, helps you to protect others. We forget that sometimes. It's not just all about me, as they could say. But also, Oksana, it's only February. And in the past 2 years, we actually ended up locking down in March and April when there was another, huge spike both times. Could that happen again?
So that yo-yo effect of no restrictions and then boom, big lockdown. I don't think we will be in that same position just because of the rate of booster vaccines and just the general immunity that is now building up in the population. But that's not to say that just because now we're seeing a reduction in hospitalizations, it's gradually coming down. London is coming down the fastest out of the entire UK. but things can still, in terms of the NHS, we could see a quick rebound in terms of number of cases. So there could be, there's still investigations on new variants that are occurring right now. And there have been periods, particularly with Delta, where we saw dips, and then where it looked like the trend was that it was coming down, whether that was due to seasonality, et cetera. But then it came right back up. So this sort of dip and dive is typical. So I think perhaps we might see more restrictions reintroduced, especially because we're lifting all of them. But I think a full lockdown on the scale of what we saw previously is not on the table, particularly under the leadership of Boris Johnson.
Okay. Ed Kelley, South Africa has said that its Omicron wave is it's pretty much over. And they instituted no new restrictions throughout the course of the Omicron wave itself. And then leading doctors are actually saying now that the virus has really adapted to us, to its human host. Is that too confident a conclusion at this point?
I think it is, unfortunately. We all know people who had Alpha and then got Delta, had Delta and perhaps got Omicron. There's some evidence now that we're looking at the Omicron BA1, the folks getting BA2. So getting infected now, which South Africa's had several big waves, so higher immunity levels than you might expect in some other countries, does not protect you from a future variant and getting infected by it. Secondly, there's a growing amount of evidence that the impact of COVID doesn't end once you've ended your isolation phase. There's a lot of cases of long COVID, a lot of ongoing research on impact on the brain and immune system that's quite convincing. Third, in South Africa, the impact on children, as well as many other countries, is really entirely untested, and most children around the world are not vaccinated. So all of those things, I think, create a question as to whether you would just rely on the virus sort of burning itself out and not seeing forward to a future variants. But again, I would come back to this impact on health systems. During this past wave, for instance, we're just producing a piece now looking at it that shows that about 28 million surgeries around the world probably were canceled during the previous during this Omicron wave by the end of it. And this will take over a year to clear. And each one of those surgeries, even if elective, is a patient and a family who was out of services. So I think that's one of the big questions we have to come back to. What's going to be the impact on health systems? What's going to be the impact on at-risk and unvaccinated populations as we go forward?
Indeed. And I mean, they're finding now that the people exhibiting the highest risk of reinfection, even of Omicron, if I'm not mistaken, are the healthcare workers, because they are constantly being exposed to cases, advanced cases, really, of COVID in the hospitals. But when we're talking about diverging approaches, Jeffrey Lazarus, you can contrast South Africa with New Zealand imposing some of the strictest measures, even at the height of summer in the Southern Hemisphere, which, South Africa is also experiencing. They have a lot more UV light, fewer people indoors. Yet here we have New Zealand doing one extreme, South Africa doing the other.
Yeah, we can learn a lot from those divergent approaches. I'm leaning more towards the New Zealand approach. I agree that the one thing is the impact on individuals and on the community, the direct impact of the virus. The other is the impact on the health system, and health systems are suffering, and that means the health of the population is suffering. And it's great that these studies are going on to show us, what's going to happen to health outcomes. We know fewer people are diagnosed for really everything from cancer to other infectious diseases. Surgeries are being canceled. So it's having a severe impact on the health of the population, even if Omicron is less virulent. And one of the reasons it's less severe, in South Africa, it was during the summer. They did have a greater immunity. Here in Western Europe, we are very well vaccinated, and the most vulnerable are, triple vaccinated. They have their booster. So there's there's a lot of confounders, there's a lot of variables and factors we need to consider. But like was said, being infected now doesn't necessarily protect us against new variants, and new variants emerge when there's a lot of transmission in the community, and that's the case now.
Right.
So I'm not saying we need to move to strict lockdowns, but there's some minimal standards we could have kept in place, like masks in certain settings, like certain indoor settings, like public transportation, using the COVID certificate, improving ventilation more generally.
Jeffrey, let me ask you, though, how much do we need to be measuring the potential psychological damage, really, of continuing with restrictions after 2 years now? Particularly, the effects of lockdowns. People are complaining constantly, especially in the United States, about kids having to wear masks in schools and how that affects their interaction. Is it something we need to take seriously, or do you think it's kind of a minor consequence of something much more serious that we have to prevent?
No, I think they're all tied together, and I think the mental health of the population is incredibly important to be studying. We also have to study not just the impact of restrictions on the population in terms of not wanting to wear masks or not wanting to have to get vaccinated, but also the families and individuals and communities that have suffered directly. I mean, there's a huge impact on people who have lost family members, too early. So you go into a hospital and people aren't coming back out again, and this is having a huge mental health impact. And there's also the divisiveness in the society, and governments play a key role in communicating well with the population and explaining that we're all in this together, because when we don't have those restrictions in place, we're going to see more cases, and that will in turn cause more mental health. It becomes increasingly difficult to protect yourself and your family when no restrictions are in place. So there's a lot of psychological health impact issues we need to be studying.
Right. Oksana, I can see you agree. Let me ask you about something separate, though. What I'm hearing a lot of scientists say is really this misconception that the coronavirus, COVID-19, is now becoming an endemic virus, and that we need to understand that endemic isn't necessarily good. Malaria and polio are also endemic, but they're still extremely dangerous viruses. Is there a risk of this misinformation out there now that could make people behave in a riskier fashion, because it's not understood that the virus still, even if it's endemic, we are still at risk?
Absolutely. I think there has been a lot of confusion around what endemic really means. And it's also been tied with phrases like, we see that Omicron is less severe than Delta in terms of risk of hospitalization. But people have interpreted that data as it's mild, it's just like a cold, and then they slap endemic at the end of that sentence. And we've seen a lot of stories with that type of interpretation. And while, yes, there is, Omicron is more transmissible, and there is more evidence now to show that there is a decrease in hospitalization. There's so many more people that are affected, and it doesn't mean that it's mild for everybody. Endemic is a word that means that it is a permanent part of the landscape. You brought up some excellent examples in terms of malaria, but HIV as well is another disease, and I don't think we could convince anyone to willingly expose themselves to that and say, well, now I'm going to have some sort of immunity to it. It doesn't actually make sense. And unfortunately, there have been tragic cases where people have refused the vaccine, have said they trust their own immune system, and unfortunately, they have not survived and have intentionally even exposed themselves to get a COVID certificate. And it's just so sad because it is linked to completely false information. And that would be the strongest message, is that vaccines protect your health, and not only from the disease, but long COVID, as my co-panelists have highlighted. There's we are learning about some of the long-term complications that emerge in even mild cases of the disease.
Right.
So certainly, we are moving towards COVID we are transitioning into an endemic state, but that isn't a good thing.
Okay, Dr. Kelley and Jeffrey Lazarus, we have 1 minute left, and I want to give each of you 30 seconds for your final thoughts here and what message you'd like to convey to the public via this forum. Ed Kelley, go ahead.
Sure, thanks. I would say just two things building on Oksana's excellent points. There's a political aspect to this, and unfortunately, a magical thinking aspect to this phase of the outbreak. One, the politics are coming in very heavy on these different approaches that countries are taking. In the UK, it happens to be gatherings. We'll stay off the political aspects of that. In the US, for instance, it's a lot around masks. But on the magical thinking part, we have been pushing out, for instance, a lot of work on trying to end the pandemic, but not coming up with the hard health systems elements that need to be there. We've been vaccinating the world, but not providing, for instance, syringes. I was just on a call with colleagues from Nepal. They have 12 million doses of vaccines, but only about 10,000 syringes. So these types of gaps have to be fixed.
Jeffrey, quick final words.
We need much better collaboration between governments and much better communication with the general population.
Okay, Jeffrey Lazarus, that will be the last word indeed for this edition of The Newsmakers. I'd like to thank all three of my panelists really so much for joining us, and our viewers for tuning in as well. Remember, you can follow us on Twitter @the_Newsmakers, and be sure to subscribe to our YouTube channel. I'm Andrea Sankey. We'll see you next time.